Yes. Hi, everyone. Welcome to the platform. It's a good day. Good, nice day today. At least there was some sun. It's not cold like yesterday. And we are going so well. Some people have been emailing me, asking so many questions. I've answered the ones that I can. And it has been a good journey. So we continue with our journey of helping people to understand and how to manage some things so that people should live positively. I started by doing mental health talk because of one thing. Because you see, when you want to get well, when you want to get well, even physically, mentally you should be okay. You should not be stigmatized by some issues that are related or myths that are related to the disease that you are undergoing. You see, your brain uses a lot of energy, and if your brain uses a lot of energy, the physical appearance or physical uh, the best way your body can respond to a drug or a disease is by having a good mental perspective. So, mental health is a very good thing. And these diseases that you see I'm going through, as you may understand, there are diseases that are long term, diseases that have been given many myths, and my purpose is to at least get away with the myths and people to understand the real thing, the what is happening and how you can manage. There are some people that have myths in their societies about hypertension. There are some people that have myths in their societies about the one that we are dealing with, arthritis. And you see, we have come to find out that arthritis is just a name, but it's a wide thing, several types of arthritis. You see, including infectious arthritis that we are going to look at, that is also carrying TB in it. You understand? So there are some things that when we are learning, we really need to focus on how to manage and how to stay healthy. I remember when I was doing surgery in medical school, the first step of surgery in a surgical school, the first unit was to prevent. Prevention is the first step of management of surgery, because if you prevent a disease, or if you prevent an occurrence, you will not find that occurrence and you will have managed a surgical condition. So, today is a good day that we are going to learn about infectious septic arthritis. So, when we talk about infectious, you ring a bell that comes in your mind about an infection. You start listening to yourself and you say, oh, this is infectious arthritis. We are talking about infection. So infectious or septic arthritis, septic comes from a word sepsis, which means a disease that is caused by a pathogen. A pathogen is something like a bacteria that has come to cause harm to your body. You understand? It is an occurrence that Aretha B is in the building. Welcome, Aretha B. Then yes, Aretha B. Your daughter had surgery. I'm so sorry about it. If you can tell us about it, we can discuss and I can help. I'm so sorry about the surgery. Sometimes, as a physician or a health worker, or people, we don't need to go to many surgeries. You see, there are some surgeries that can be avoided, and there are some surgeries that are a must. So if there is a way you can avoid a surgery and do conventional treatment, at times it is better than cutting through your body and coming up with surgeries. Yes, but if a doctor has seen this is a must, please comply with the doctor. He knows much about the condition. Yes, we continue. We had said infectious or septic arthritis is an infection of the joints, typically caused by bacteria. It is caused by a bacteria, virus, or a fungi, leading to inflammation, destruction of joint destruction of the joints, and systemic illness. If untreated, it is a medical emergency. You know, bacteria, we saw most of them when they come to your body, they attack several places, like the psoriatic arthritis. Psoriatic arthritis, it attacks the ethers of the bone. Ethers we talk about where the bone attaches to a tendon. You see. Now, let's see this infectious arthritis. And today, thank you, welcome, Aretha B, welcome. Today, as we talk about septic arthritis, I'm going to talk about a special condition called TB arthritis. You see, because TB has been a very complicated story on the people's life. So, if you know you have a person that suffered TB, you are told this person had suffered TB, and this TB, it was not a TB of the lungs, because we have tuberculosis, and this tuberculosis maybe is not for the lungs. We will get to understand that it is very important to know TB can affect every place, including your stomach. And today, because we are talking of arthritis and infectious arthritis, and I've talked about how infection occurs. TB is an infection, and it brings a form of arthritis. So today we are going to talk about an infection of TB, how it goes to the body and how it attacks the body. So we continue. What are the causes of infectious arthritis? When we talk about infectious arthritis, I've said we are talking about an infection of bacteria, fungus, or viruses. The most common, it comes here. It is a bacteria. A bacteria. It is the most common. Bacteria are everywhere, and they are so pathologic. They destroy our bodies so much. And some bacteria are good. So when we talk about the bacteria, there are several. Beauty, Benjamin, and everyone. Thank you, Beauty. We are talking about arthritis, but today we are talking about arthritis of infection. You get an infection, then you start having the arthritis. So we continue. You see, we see here bacteria is the most common cause of arthritis. So if the bacteria is the most common cause of arthritis, what do you think? What do you think is happening here? There's types of bacteria that cause arthritis, including tuberculosum, TB. So the first common cause here you will see is Staphylococcus aureus. Staphylococcus aureus, most common, is a common bacteria that you have in the skin, around the skin, where it helps your skin not to, it lives symbiotically with you. Because when I'm saying it lives symbiotically, it is helping you not to get bacteria that will inoculate to your system and go through. It eats. But when it is so high, it becomes pathologic. It damages your body. And then we have another one called Streptococcus species, like S. pyogenes and S. pneumoniae. Now, pyogens means pus. That is the bacteria that causes pus. When you have a boil, if someone has ever had a boil, this is the bacteria that causes the boil. It brings pus accumulation in your system. So if it brings pus accumulation to your system, this bacteria can eat your tendons and that can eat your bones. It makes your bones do what? It makes your bones to rot away. And pneumoniae, Streptococcus pneumoniae is the one that brings pneumonia. So if you have ever had pneumonia and then you start feeling your bones are weak, you see, if you have ever had pneumonia and then you start feeling your bones are weak, know that it was going to work on your bones, but because of your immunity was so your immunity was so high, it decided to kill the pathogen. So that is how bacteria release. There are some people that have got Neisseria gonorrhoeae. Gonorrhea is a pathogen that is sexually transmitted. When they get it, it stays in your body, in your body for some time. And when gonorrhea stays in your body for some time, it will inoculate to your bones. And when it goes to your bones, you have healed the sexual transmitted infection, but now you come and start having problems of arthritis secondary to the transmission of sexually transmitted disease that you are having. So it is very important when you have an infection, when you go to a doctor and have an infection, a serious infection like pneumonia, and in your bloodline, maybe you saw your aunt or your sister or someone in your blood family, nimekutumia tokens, enda uweke. In your sister having this, it is good to go back to your doctor. You understand? It is good to go back to your doctor and tell your doctor, I'm feeling my legs are not like always. They will try and find out what is happening. So I've talked about bacteria because when it comes to bacteria, you see, it is high, they have high levels of infection, but they can cause you to have arthritis. We will see how they cause arthritis, these bacteria. And then we go to viruses. Although viruses are not so much into causing this, but there are some things like parvovirus, hepatitis B, C, and rubella. Usually, they have mild symptoms. And it's self-limiting. But there is one that is very bad one. A very bad species called the fungus, Candida histoplasma, usually in immunocompromised patients. Now, if you are a lady and you are listening to this, please listen carefully about it. You have ever gone to a doctor's office, you are written and some antibiotics, and then you go home. So when you go home, what happens is you do what? When you go home, uh, just about to finish the antibiotics, what happens is this: you start having a white rash. If you have ever had this, know that some bacteria help you down there to kill the fungus because they eat the fungus. You see this, they eat the fungus. But now, when you have taken antibiotics because of an infection, you are destroying even the good bacteria that is helping you health-wise around your sexual area. So this is for women. So it comes out, the white is yeast. And you see, yeast is a fungus. Something else comes in that is called Candida albicans. That is a fungus that disturbs women. So when it comes in as Candida albicans, what happens is this next. Mostly if you are immunocompromised, it will start to inoculate to your system and it will inoculate to your bones or the tendons. You get it? So most people that are having immunocompromise is your immunity is down. These are people that have diabetes, chronic issues of metabolic syndrome like diabetes, infectious arthritis, others like hypertension, and others that are having HIV. They are prone to this because they take drugs every time. People that are diabetic take antibiotics so much because of There are a host of high sugar levels, and bacteria love that. So we continue. We have talked about the fungus. Now we see some things in life, and then we start wondering why. Why am I saying this? Risk factors, people that are prone to these things, people that are prone to infectious arthritis. Hmm? There are some people that are always having problems. First of all, the first point, age, more than 80. You know, when you grow old, your immunity lowers a bit. So you are prone to infectious arthritis of what? The causative agents that I've said. Pre-existing joint disease. So you can have rheumatic heart disease, rheumatic fever, you can have rheumatic arthritis or osteoarthritis, but you still get infectious arthritis because now it is coming in as a secondary infection. You see, and then there is something called prosthetic use of extended limbs and the use of artificial um, limbs. You see, not even artificial limbs, some artificial projections like steel. You have maybe your iliac, your humerus bone was destroyed in an accident, or you have a condition called osteogenic imperfecta. Those people that they have a problem, their bones are so weak they just break. So they decide to replace your humerus with another thing called stainless steel prosthesis. So what will happen? You see, it will bring some problems because it's a strange thing in your body. There will be always infections and infections. Diabetes mellitus, people that are diabetic, I've explained how diabetes can be a problem. Immunosuppression, HIV steroid use and chemotherapy. Now, you see, HIV is this. Let's learn about HIV a bit because now we are talking about infectious arthritis in a quick way. A virus gets into your system. There is a receptor in the cell which accommodates the virus. When it gets into your cell, what happens is it copies your DNA because it is an RNA. You have a DNA. So RNA copies the DNA and then they start multiplying inside your cell. A virus, they don't do fertilization, they multiply. They copy the DNA, they create other viruses, and then it bursts. That is how a virus replicates, how a virus comes out with other viruses. So when they get into your cell, and it copies the DNA and parts, it destroys that cell. So if there are many, they are destroying the cells. So that is how your immunity comes in. You get it? So when I'm talking about immunosuppression of HIV, I'm talking about that process of a virus getting into a healthy cell, copying the DNA and creating other many viruses inside the DNA and then bursting, leaving that cell dead. That is destroying the immunity cells of your body. You get it? Now, we have something else called steroids. People that like to take steroids, prednisolone, and diamides, drug modifying drugs like the one that we talked about yesterday. Those drugs, what they do, they slow down your immunity. Prednisolone, they slow down your immunity so that the cells that come out to tell your body there is a problem, they are not doing their work. You see, if they are not doing your work, so bacteria will come in and they will inoculate everywhere, and the viruses will copy your cells and they will destroy all the cells. You see, chemotherapy, people that are on chemotherapy. You see, immunosuppression is not only about HIV, It is about everything. What I'm talking about. HIV is part of it. Chemotherapy. Chemotherapy, people go to get chemo. Cells are destroyed, and then what do you find? Do you have low immunity? Recent joint surgery or injection. You get it. You can get there. You can be injected by an unsterile needle, and then you get an infection from the joint, and then it starts to be arthritis because it will kill your synovial joint. And if it kills your synovial joint, what will happen? Infection. Intravenous drug use, with a person who is not taking good care of sanitation. Now, how does these things happen? Because now we are talking about infections and drugs and sometimes immunosuppression. They spread through the blood. A bacteria enters via bloodstream from a distant site from common, and then they go to the bloodstream. Or direct inoculation, you can get trauma. Something can cut you, and then bacteria gets in, inoculates to your body and goes to your cartilage. And you see, your blood is made to inside the bones, and even your kidney helps with the hormone that creates blood. So if you get a bacteria that goes inside your blood, be sure it can go up to the bones inside the bone marrow. You get it? So this is how things spread. Contagious spread, infection from near bone tissue or soft tissue, osteomyelitis. Some bones, when you get a wound that is not healing and it gets to the bone, you get something called osteomyelitis. And it gets, because your bone marrow creates blood, the red blood cells. What happens? And other cells like white blood cells, it gets infected. So when it gets infected, your bone starts to be weak. Eh? Now, when the bacteria gets to the joint, we drew something here yesterday, and let me see if we can check out it again. When the bacteria gets to your Marilyn, good morning from New York on the job. Listen, good, thanks, Marilyn. When the bacteria that has inoculated from your bone, from a wound that is there and it has gone up to the bone, what happens? It goes to the soft place of your bone. Remember, this is the femur, foot, and here down we have the tibia and fibula. So the soft part is where the bone ends. It will go up to here, the synovial place, where you have the cushion of your bone. So when it goes here, what does it do? It gets to the synovial joint fluid inside, the bag that holds the fluid that helps you to cushion this place. It helps you to cushion the place that has your movement. It works like a lever. It works like a lever. Look at this. This is a lever. You have several bones here. This one is the patella. If you touch your knee, you will find another soft bone, another hard bone just in front. It is called the patella. Bes- be, just behind the patella is where we have the uric, the synovial joint. You see, so the synovial joint is here. So when the infection gets here and gets in, now the synovial joint gets infected. Why? Because the fluid there is infected. So if it is infected, what happens, my friends? Arthritis starts getting in, because now these joints will be hard. You remember the how we said, if there is an infection at your joint and this is a bacteria eating it and it is being brushed over and over again, here, this is the joint, what will happen? One, there will be an inflammatory response. And you remember what we talked about inflammation? Inflammation is redness. Your body is trying to fight to be okay. And then there is pain. There is pain. If there is pain, welcome Roger Killer, we are continuing. If there is pain, What else comes in? After redness, pain, your joint starts to swell. Just imagine you've got a bacteria from a wound, it has gone to your body, inoculate, and then it is on your joints now. There is swelling. That is inflammation. Yeah? The triad of inflammation: redness, swelling, hmm, and pain. So when you get the pain, what do? The bacteria is still working. It is eating the cartilage, eating and eating and eating the cartilage. If it is eating the cartilage, it releases proteolytic enzyme by neutrophils. And then the proteolytic enzyme comes out with rapid cartilage destruction. Now, your cartilages are destroyed. We continue, my friend. You see, now you have started having problems with movement. Please, if you have a question, ask me, because I will not, I don't want you to be stuck somewhere, or maybe your family member has a problem and you cannot explain. Let's help each other, my friends. I'm just here to offer guidance. And if you need guidance, let me help, because of I have the knowledge, and let's share the knowledge. Now, clinical features. How does this person present? Now, this person is having a problem, and you want to know, and you want to pinpoint that this is infectious arthritis. What does it? It's when we talk about arthritis, the first thing that comes to your mind is swelling, pain. You see, lack of movement. Yeah? So redness around the joint. So severe joint pain, a single joint. Commonly knee, hip, or shoulder, swelling, warmth, and redness. That was the triad of inflammation. Reduced range of movement. You feel so hard and pain when you are moving. Fevers and chills. You see, when it is a bacteria inoculation, you always get fever. So this is an arthritis. You are having an arthritis, but on the other hand, you have fever and chills. You get it? So we will have gonococcal arthritis. If you have gonococcal arthritis, gonorrhoeae, what do you have? Migratory polyarthritis. Today it's here on the fingers, tomorrow here. You're feeling movement is stiff, you can't move well. You get it. And then there is tendinosynovitis. The tendons are being eaten and stiff and very painful. Tendons are the ones that they they in the fingers, they connect so that you can move and still come back. They are like, we say, rubber band tendons. They are the levers. So tendinosynovitis. Vitis, anything in medicine you hear about vitis, it's an infection. And anything you hear about litis, it is distraction. So skin lesions. Sometimes you find some people have lesions on the skin, on the face, on the hands. You see, and pustula, they are swollen with some pus inside, and you have stiffness. You get it. You know this is arthritis. So how do we know this is arthritis? You aspirate where the swelling is. This is done in the hospital. You aspirate, come if it is the synovial fluid at the knee, we aspirate the fluid inside the knee. So when we aspirate the fluid inside the knee, what do? We take it to the laboratory. We look at some things called white blood count. We stain to rule out gout arthritis. We do crystal analysis. You remember the gout arthritis that we did, and we found out about the crystals. We rule out that crystal analysis, and we stain to find out the organisms that are in the fluid that we have aspirated, we have removed from that side. We culture to find out. And then the other thing in arthritis that is so important, every type of arthritis, an X-ray. You want to find out the degree of destruction of a bone. and the degree of displacement of a bone. You see, if you are used to, where is that my diagram? Soon as I'll be in a studio where we are not using diagrams that I've drawn. I'll be using real diagrams. Now look here. Look at this diagram. A very nice diagram. If you do an X-ray, this is how we find out. This is the femur, the bone of your thigh, and this is the other bones. You see, this is at the knee. So if you do an X-ray and you find out the space is supposed to be like this, but it is reduced like this here. It is reduced like this. What do you think? You think of this. There was an infection, and when there was an infection, what happened? Synovial fluid leaked away. If synovial fluid leaked away, the space reduced. This person is having pain and difficulty in movement. So we will know that this one is a sign of a typical arthritis. But now it is coming with some bacteria inside the fluid that we have aspirated. So it is infectious. You get it? And then there are some diseases you might confuse about infectious arthritis. Diseases like crystal-induced arthritis, gout and psudogout. They share the same symptoms. Like they share the same symptoms like the swelling is in all arthritis. They share the same symptoms. And then we have osteoflares and diffusion. So the bones sometimes may be destroyed. You get it? And the reduction in space is normal. But the key feature here that says this is infectious arthritis is the bacteria, the fungus that we have found out in aspiration of that fluid. And if we do microscopy and we are not seeing those crystals, what do? We know that this is not real gout arthritis. Those crystals that we talked about, they are called monosodium urate crystals in gout arthritis. So people, this is something that is very important. Once in your family you have a history of arthritis, and one day you are sick and you have gone to a doctor, and from a doctor you have found out that you can't walk well even after you are treated 2 weeks after, please go back to the doctor to find out why. A person who has undergone sexually transmitted disease like gonorrhea, that bacteria called gonococcus, it's a very bad bacteria. When it goes into the system, it can go and destroy your bones by eating it slowly, and you are not moving on well. The treatment in this is always antibiotics if it is a bacteria. If it is a fungus, it's always antifungal. If it is a virus, we do antivirals. You see, now the antivirals you use in these conditions are not the antivirus that we use in HIV. These are other antivirals that are used to help so that this virus can go down. You get it? Now, complication at times when it's not treated, chronic arthritis, joint destruction, osteomyelitis, septicemia, and bacteremia. Septicemia is high load of bacteria in your body, and you're having so much fever until you can go to shock. This one is always demanding an admission to hospital to be closely monitored. You see, it can go up to your organs like the liver and the kidneys, and then you start having some problems like the kidney function is not okay. Now we continue here, and if you have a question, please don't fail to ask, because questions motivate and questions make you to know more and advance and know deeper on what you don't know. Now let's talk about TB arthritis. What do you know about TB? You have gone to a hospital and you had someone had TB, or you are diagnosed with tuberculosis. Tuberculosum. What do you think it is? Tuberculosum is a chronic infectious disease caused by a bacteria called Mycobacterium tuberculosis. I usually call it tuberculosis, a stubborn thing, a very stubborn thing. It cannot be treated with one drug. You have to have like several drugs so that you can treat it. You get it? You have to have several drugs for you to treat it. Hmm? It is seen when you do a culture. It's a bacillus, a bacillus. Sometimes how it is transmitted is airborne and droplets, coughing. Hmm? Yes, Marilyn Agustin. Today you will learn about TB arthritis. It's a very bad situation, and it's a very important situation. Uh, TB has been contained for some times in Nairobi, but because of what is happening nowadays, it has started to rise again. So we're gonna know that is it has started to rise, but it is being contained. You get it? Marilyn, TB is associated with arthritis, and that's why I said TB, the kind of TB that people are used to is the TB chest, the TB that happens in your lungs. Why? Because the mode of transmission of TB is transmitted through cough. When you are seated around a person who has TB and is coughing everywhere and bringing droplets to you, those droplets containing TB may inoculate to your system, and then sometimes you start to sneeze. You sneeze and then you get those droplets. Human are the primary reservoir, and rarely animals. You see, if the inhalation of the bacteria droplets called the bacilli reach the alveoli. Alveoli are inside the lungs by and are the macrophages are ingested by macrophages. Macrophages are cells of your body that sense this is a danger. They take that bacteria and they eat it and destroy it, and then they remove it to the body. You get it? Hmm? So when immune response awakes, macrophages comes in. Formation of granuloma tubers to contain infection causes chronic necrosis in organ or granulomas. You see, so let's talk about TB. We have seen TB is caused by a bacteria which is complicated bacteria, because this bacteria is supposed to be treated by like 4 drugs: isoniazid, rifampicin. Those are the drugs that treat TB. And then we have another special guest here who is TB arthritis. So what is TB arthritis? Tuberculosis arthritis is a chronic, slowly progressive infection of the joint caused by Mycobacterium tuberculosis. Is a type of osteocular tuberculosis. Osteocular tuberculosis only meaning TB that infects the joints and bones. These medical terms at times they seem big and they mean just the normal things. You see, like here I'll say osteoarticular tuberculosis, osteoarticular. And you see, articular is a surface where a bone meets the other bone. So TB arthritis infects the joints of a bone where they articulate, where a bone meets another bone. Like where? Shoulder bone, this is a bone meeting another bone. Elbow, this is a bone meeting another bone. And there is a very special place that it likes. You see, the very special place that it likes. I drew it yesterday. Where is it? Let me see, where is that thing of mine? Yes. Let me see. Where is this? Yes, here. It likes the backbone. Hmm? The backbone. Why? Because the cartilages here are soft and the bones are main. You get it? So it comes between the bones of the back. Yes, osteoarticular tuberculosis. So don't hear about these medical terms and you feel they are so big. No. Osteo means bone. Articular means where the bones articulate, where they meet each other between a cartilage. You see, and tuberculosis is the disease and often affects large wearing weight-bearing joints. So your backbone holds a lot of weight. So there is where this will come and they will eat those cartilages. Unlike acute bacterial septic arthritis, this one is not acute. It will come and it will stay. It can cause you to be permanently disabled. TB arthritis is usually painless or mild painful initially and progress very slowly. At the beginning of you getting this tuberculosis, you will not notice. You get it? It is very slowly coming in, eating the cartilages very slowly, and mostly it affects around the back pain here, the thoracic. So you will be being treated of pneumonia. Pneumonia, you go to the doctor, he says, oh, this is bronchitis or pneumonia, let's treat. And then they give you antibiotics. Not for TB, this may end up you having some aristopath checking in. So aristopath, welcome. We are talking about TB arthritis. TB arthritis, guys. If you feel this information is helpful at times, it's good to like the video and share and tell a friend that there is someone who helps and he is called Benjamin the Wise Guy. You can check on his videos. You see, it is very important. Let's help each other to spread good words. We have said it is spread through droplets. Yes, sneezing, being near a person who has TB, and then it goes to your chest. From your chest, it inoculates to the system up to the back. But you see, another thing is there are some people that have stayed near a person who has tuberculosis and they don't contract. It is a matter of immunity. If your immunity is good, those cells called the macrophages, they will take that bacteria, deal with it, and you will not be infected. They will kill it. But don't predispose yourself saying you have good immunity, because you can say that and then it perceives the immunity you have and you will be now infected. You see, the infection phase means you have the bacteria, but it's not causing the disease. You can get the bacteria, but it's not causing the TB because your immune system is fighting it and removing those cells, or those bacteria. And after time, they'll be removed, all of them, and you are good. But now, when you have now the disease, is whereby now the bacteria has surpassed your immunity and now it is causing symptoms. You are now actively getting the symptom. You get it, people. Now let's go, my friends. Let's go. Roger Killer, I'm seeing you. Duty, I'm seeing you still here. Mary Agustin, I'm seeing you are here. Thanks a lot, Aristopath, coming in to join us. This is very good. Let's learn about TB, tuberculosis. People get TB and they start asking themselves, how did I get this thing? Crowded areas is a place where you can get TB. Now, you can be wondering, what is the risk factors? What can make me know that I have TB? Or no, I can get TB very fast. You see, if you are HIV infected, your immunity is low because I've told you how HIV kills your cells. It gets to your cells and helps by yourselves to get other HIVs. So it reduces your immunity. Malnutrition, if you're not eating well, if you ain't eating well, it can be a problem. Pulmonary TB. If you have active TB of the chest, you can continually go on and have active TB arthritis. Because now it will inoculate from your chest, you have not been treated well, and then it will go up to your bones and start eating the cartilage. Now, this is the how TB comes in and spreads. Hematogenous spread is blood spread. From primary TB focus of the lung, it goes to your blood, and then it goes adjacent to the bones. You see, we are you inhale some droplets that have TB. They get to your chest. Where is the next place they can move from hematogenous? Because they want to eat your cartilage. They'll come to your back, bones, and they'll start eating the cartilage. That's why most people that are infected with TB, arthritis, it comes to the thoracic backbones. They are always complaining of the back of the chest and the back. I'm feeling pain here behind my. Why do they feel that? Because here we have cervical plexus, and there is a nerve that comes in here that helps this place. So if you've ever seen a patient of TB complaining of the back at the apex here a lot, fifth intercostal space is here. Let me rise up here. Just know it has started eating the bones of the back. And now it has started from pulmonary TB. Pulmonary TB is chest TB. It has gone to the TB that is on the back. TB arthritis. No, it destroys the cartilages around the thoracic the thoracic space, and then it starts going down. And you see, I will draw something. I will draw something about TB. I will draw something here. Very important. Very important. We are safe, beauty. The only thing we really need to live is to live. If and protect ourselves when you know there is a problem. Now, look at this. A cartilage looks like this. A cartilage looks like this. This is your backbone. It looks like this. Your backbone, it looks like this. And then there is another backbone that is like here. This is a section of your bone, but there is another section that is here. This in red, that is the cartilage. You see, now let's take like this section. One of this section is this section. You get it? So if this section, one of it is this, whatever that is here, this one is a cartilage. Why a cartilage? Because I can move down, I can turn. Should be elastic. If all of your the whole of your backbone could be bone, you could not be moving. So it should have some elastic areas that can allow movement. But now TB has gone to your chest and it has inoculated behind. Where will it start eating? The cartilage. It will start eating the cartilage because the cartilage is the soft part. The bone is the hard part. After it has eaten the cartilage, what will happen? Your cartilage, the joints will reduce, and then it will be, maybe the cartilage will come out like this. when you do an X-ray and you see something like this, it is being compressed like this. What does it say? It says that part of your bone, of your cartilage has been eaten, and now you have lost the normal balance of your bone because TB has eaten your bone, and now it's looking like this. What will happen? This is what will happen. You know, these cartilages have nerves that move below them like this. And nerves, they are the ones which push your signals. You see, the nerves that come to the cervical plexus to for if you feel pain, to allow movement, you get it. Those nerves, now what will happen? Because now this is, you see, they'll be compressed. Because let's say this one will compress, it will be compressed, it will come from inside. The above one maybe might go like that. Instead of these nerves coming out from the normal thoracic spine like this, now they are coming out like this, like this. What do you feel from this one, which is normal, to the abnormal one? One, you will feel something called paraesthesia. Paraesthesia is tingling sensation on the extremities of, because the nerves are compressed. So where the nerve goes, it is not sending the signal well. That is the first thing you will feel. The second thing you will feel, what is the second thing you will feel? The second thing you will feel is pain. Now, because it is compressed, it is compressed. Pain, inflammation. You remember the triad of our triad, three things of inflammation: pain, readiness, and warmth. You get it? So this is what will happen when you have TB eating your cartilage. And then you have not been treated. Now the cartilage are brushing against each other. They will go and destroy, and this cartilage that is here will be destroyed totally. So the bone will be brushing against this bone. If it is brushing against this bone, one, the normal curvature of your backbone is destroyed. If you are seated upright like this is a patient that has not been treated now. You find a patient is you see is sitting like this or bending because the normal curvatures have been destroyed. We have said it commonly affects the joint, shoulder joint, elbow, and wrist, usually monoarticular. Shoulder joint, elbow, and wrist. Why? Because it spreads through blood to the joints. But most of the people, if you find out about TB arthritis, you will find them, they are affected at the backbones. Why? Because from the chest, and then it inoculates next to the chest cavity. You get it? It goes to the chest cavity. Where does it go next? Back to the cartilages. Here down, they will go. So a person who has TB arthritis, most of them you will feel them complaining about here, here. This the safe area. It's called the fifth intercostal space because there is a nerve there called the phrenic nerve that comes down here to help breathing. And you will find that these people, they have breathing issues. Why? Because the phrenic nerve controls the breathing system. You get it? And that's why when you go to hospital, most of the TB patients are put on oxygen because the phrenic nerve is kind of like being eaten and they should stay on. You understand? Now, let's continue. Please, if you are watching and you are feeling there is a question you should ask, please ask. Now, we continue. We see how it gradually comes. Gradually comes. You have inhaled, someone has just coughed around you, is not having a mask and is really coughing, pushing the aerosols away. You breathe and you laugh around. You say, "Hey, stop that! Stop!" You see, you are making it as a joke and you are inhaling it. So when you go next to a hospital, always be on masks. You see, Very important. So when you bring them inside when you've inhaled, the first days is the incubation period. Very calm, your chest, you're just having normal coughs and subsides. And then you start having night sweats. Night sweats is a very important thing when it comes to TB. Night sweats and fatigue. And then after night sweats and coughs, now it has gone inoculated to the backbone, to the articular surfaces. Articular surfaces, I've said, surfaces that can move and where the cartilages are. Now, this is a part. This is a part of this. This is a part of, this is your you. You see, this is you. Let me move it like this so that people can see it clearly. This is you. This is you. This is part of this. So this one is from this is the appendicular and axial skeleton. So this is the pelvis, these are the legs. This is the rib cage. So this part is this. But now whatever I've drawn here, this is the destroyed one. So when your lungs are here, and you inhale, the first place they will go is where? They will go back to the spinal cord and they'll start to eat your cartilage. You see, the weight bearing joints, hip, knee, ankle, the big joints. No, now we were saying how it starts. You have inhaled, it has inoculated. You start having joint pain and swelling because the cartilages are being eaten and the inflammation has taken over. Swelling, redness, and pain is there. You start having stiffness and reduced range of movement because now the cartilages are destroyed. You have less movement. You get it. Minimal systemic symptoms like fever are seen. At this stage, you'll have some minimal pain is there, but fever is not so much. Occasional cold abscess may form near the joint. Because now, if a bacteria is eating your cartilage, it will produce some things that will bring pus. If tuberculosum is eating your cartilage, you start having pus. So you may see some pus and drain it and you think it's a normal thing. My friend, it's not a normal thing. So you will go to a hospital, you talk to them, you tell them, I've been having some pneumonia. People always say chest pains and coughs, arthritis and fever is pneumonia. Please look at me. The doctor looks at you, asks you, do you recently have night sweats? You say yes. Coughs? Yes, they are so bad coughs that I cannot even stop at times. And central chest pain, my doctor. And then this doctor tells you it's okay. Go to the radiology department, take them this. They do an X-ray. They find out that no, this person has a problem. The bones are not correct. And the chest of itself, it has some things called miliaries, white patches. It returns you with the report to the doctor. Now, the doctor says, no, I have to confirm this. You are given 3 bottles. You are told, go back home, you come with the morning sputum, but do it 3 times. You go back to the hospital, and then after you go back, they tell you now we have to confirm some things. They do a higher radiological measure. They do an MRI or a CT scan. When a pathologist looks at that, he sees, oh, this is typical arthritis on the back. It has eaten the cartilages and eaten to the bone. The confirmation of gene expert. Gene expert they look and they find the bacteria itself. They find that in your sputum there is this bacteria. Now, my friend, you know what next? There is no any other way, but you have to do what we call, you start taking some drugs specifically for TB. They are called isoniazid, rifampicin, pyrazinamide, and ethambutol. Isoniazid, rifampicin, pyrazinamide, and ethambutol for 6 months. The first weeks you are isolated, so that they may ensure you continue with those drugs so well. And people, my my friends, this is a very important thing that I want to say. If you personally or a friend has been diagnosed with TB arthritis or TB pulmonary of the chest, please don't kill the world. Take those medication as are is needed. Why am I saying this? It is very important, I insist. You take those medication religiously. Because if you don't, you will not only harm yourself, my friends. Listen to this carefully. You will not only harm yourself. If you don't take those medication well, this is what will happen. The bacteria can mutate, or this bacteria can do what? This bacteria can gain a resistance. If the drugs since I was born to treat TB has been isoniazid, rifampicin, pyrazinamide, and ethambutol, since my life, I've known those are the drugs that treat TB. And then you get a resistance of a strain of these drugs. It means if you spread TB to another person, you are spreading a TB that can't be cured. You know the effects of TB? If you are spreading something because of your own negligence, you have decided these drugs are so many, let me just take them. Today I've taken, tomorrow I've not. The other day I stay for a week, I take. Then the drug gains resistance of that drug because you are giving it a way to fight that drug. My friend, you will not be treated, but as you walk around, you are spreading a resistant strain to other people. That means you are killing the world. It is very important to follow the doctor's advice. Resistance of antibiotics is not good, especially of this TB arthritis. Because now, if these are the drugs that me as a doctor I trained on, and I'm seeing some other drugs are coming out, but they have not been effective, and then you, because of your negligence, you bring another resistance strain. You see, it's a problem to the world. So don't ask where, when you go to visit someone in the wards and you are told he cannot be discharged, and this person looks okay. It's only the drugs that he's taking. It's because maybe the doctor noticed this person will stop taking the drugs. So let this person stay for 6 months in the wards until those drugs are over, then I can discharge now when it's okay. So that was a very important point. Please take note about it. We continue. As we take the drugs, the isoniazid, rifampicin, pyrazinamide, and ethambutol for 2 months. The second 4 to 10 months, 4 to 10 months, continuous phase, we take isoniazid and rifampicin only. So for the first 2 months, we take isoniazid, rifampicin, pyrazinamide, and ethambutol. So followed for the next 2 months, we continue with isoniazid and rifampicin. And then there are some places where the cartilages are eaten and there's a lot of pus. What do? We drain the cold abscess so that we wash, and then we see the degree of destruction. After we see the degree of destruction, what do? We try to do some processes, because some TBs hit the joints until they are totally destroyed. So you have to put a processes. Synovectomy. and debridement. You go, you remove the bad synovium, you replace, and debridement of the dirt. Please don't feel it as a very bad thing. It's good information. It's good information. I see people are so quiet today, very listening. It's good information. Imagine I'm helping someone so that he cannot get resistance and kill himself on the one. Hmm? My friends, like the video, man. Like and share. Don't be worried about life. God has given you as life, and you are living. So joyous. Let's just live and avoid bad things. I'm just giving you ways how to survive, at least to avoid getting these issues. But if you find yourself getting one, you know how to do it so that you can live better after. You get it. Don't be so worried about life. Hmm? Let's not get mental breakdown. So if we have drained, we have replaced the synovium, we do supportive care. Physiotherapy. Imagine TB has eaten you and has eaten your bones. Until now, we are taking you to physio to try and help you to walk. Hmm? Imagine. Hmm? So please, people, one, when you have been around people that have TB, always be in the mask. When you are around a crowd that you don't know, wearing a mask is not a problem. Especially a place that you know is prone of TB. So now we know how it can end up. But the main thing that I've said about TB, please, if you have a question you ask, is resistance. If you have a relative and you're seeing this relative is playing around those medication, report that person to the government around you. Report, because it is not good to have a resistant TB strain. It will spread, and if it spread, hey, you are killing the world. Now we continue. Today we have talked about TB, arthritis, and we have really learned. We have really learned, and I've talked about TB arthritis because it lies under arthritis. It lies under arthritis. There is a very special forum that is coming where we only talk about TB. And you will see TB can affect you anywhere. TB spine, TB chest, which is pulmonary, TB abdomen. I will explain and we will talk about every TB. So you don't talk of TB of the chest alone. So the next thing that we really need to talk about that we left is pseudogout arthritis. We talked about, if anyone has any question about TB arthritis or the other arthritis, infectious, please ask. It's an open air for questioning and discussion. So let's talk about what we talk about, the pseudogout. What is pseudogout? This is pseudogout. We had to talk about it when we were talking about gout arthritis, but we left it. We had to talk about infectious because of this TB arthritis. And pseudogout is another one, but now this one talks about calcium phosphate deposits disease. You see, just as uric acid deposits, you see, just as uric acid, we have something else called pseudogout. But now, pseudogout is dealing with calcium phosphate. Calcium phosphate is 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 brought out by calcium crystals. Now, pseudogout, even the calcium crystals can come out and form inflammation and pain just as uric acid. So pseudogout is an inflammatory arthritis caused by calcium phosphate dihydrate crystals. And you remember the other one, which was gout arthritis. Dorothy, mwambie ngoja tu nimalize hii then I see. Yes, you see, the other one we talked about monosodium urate. Monosodium urate. As from now, I'll wear mask in public places. I don't want to get sick. Yes, it's very important. Mostly when you hear there is a breakdown of a disease, if there is a breakdown of coughs and some flus in your area, please put on the mask, because you really don't know if it is a breakdown of TB or COVID or what. It's good to protect yourself. Now, beauty, it's very important. Protection is not being stupid. Wait until it happens so that you will know. So protect yourself when you're in public places. No, now we continue. Just as the other one, which was monosodium urate crystals, this one is a case of calcium deposits, calcium sodium deposits in the articular cartilages. Now, calcium is worse because it makes your bones stiff. You see, so pseudogout arthritis cause is deposit of calcium phosphate dihydrate, cartilage and synovial. So when calcium is deposited at the joints, what does it do? It makes your joints to be stiff. The crystal shed into the joint spaces, and then they trigger the same inflammatory response. They trigger inflammation, they trigger pain, they trigger lack of movement. You see, pain, inflammation, and swelling. Yes. So, what is the problem here? What are the risk factors? Who can get these problems? Age, over 60 years. If you are over 60 years, you be careful. Joint trauma and surgery. The surgeries we get ourselves into. Metabolic and endocrine causes like hyperparathyroid. You see, the parathyroid gland, when you will talk about thyroid regulation, you will see there is something else called parathyroid, which regulates your calcium. So if it is not okay and it is bringing more calcium in your system, more, you will get what? This problem. Because those calcium phosphate crystals will start to deposit. Hemochromatosis, the kidney. You see, hypothyroidism, you will have these problems. Hypomagnesia, because of the balance of magnesium, and hypophosphatias, phosphate problems. And mostly people with osteoarthritis have problems when it comes to deposit of calcium. Commonly, it affects the knee, the wrist, the shoulders, ankle, and elbows. Why do it affect this? It affects this because of causes stiffness. When calcium phosphate are deposited in the cartilages of your joints, the joints become stiff. So when you wake up in the morning, you get joint pain, swelling, warmth, and stiffness. It may be one or two joints. And these pains may always mimic gout arthritis. People will say, I have gout, and it's not gout. What is it? It is calcium phosphate. That's why it's very important when you go to hospitals, you do this test. You are not given drugs thinking it is something and it's not that thing. Because you see, these problems, they share symptoms. And you see in arthritis, our triad of symptom, which is inflammation, the three, pain, swelling, yes, pain, swelling, and redness, everywhere, everywhere. So it's when you're told, please let's do this test, don't deny, just let the doctor do. Fever absent or mild. Because it is calcium deposit, there is no infection. Unless there is an infection, you will have fever. But this one does not have fever. Sometimes you may have. I have the joint pain in my wrist, a hot pain. Marlin Agustin, uh, is there something that has swollen around your wrist? Please let me know if there is something that has swollen or is just a joint pain. If it is just a joint pain, let me know. Now we continue. Diagnosis: gold standard, turbid fluid around where it is swollen. You get it? Rhomboid shaped, no swelling. Okay, if there is no swelling, please go to your doctor around where you are, explain the pain. But if it is a pain brought by the nature of work that you are doing, you just know it's the nature of work, because maybe you are used to carrying loads. Because if there are some people that are like waiters, you see waiters carry trays every time, and this wrist, this joint, it's always it's working, and then there is pain. So check if it is the nature of work or it's a spontaneous pain. If it is spontaneous pain that you have not been hurt anywhere, or trauma has not, or something did not hit you, just go to a doctor, explain, get rid of whatever you may be thinking. It's good to be 100% sure there is nothing bad, rather than staying with the pain that you don't know. Okay, we continue. Now, in monosodium urate crystals, you saw they were sharp and straight. But here we have rhomboid shaped crystals. This is what we look at in the laboratory, and we see this is not monosodium urate, uric acid. This is calcium phosphate, positive briefing under polymerase light microscope. We look them at the microscope. So the X-rays will show chondrocalcinosis, calcium calcification of cartilage, especially in the meniscic and triangular fibula of the wrist. Because there is a calcium deposit, you will find that there is deposit. The cartilages are hard. That is what we call chondrocalcinosis. So for acute, for first line here, because here we are not dealing with uric acid. Uric acids are treated by something called allopurinol. They bring down the uric acid. But here we have something called colchicine to balance the calcium phosphate crystal. You see, and NSAIDs. NSAIDs, I said you be very careful. They are painkillers, but they can destroy you. The NSAID like aceclofenac and diclofenac. Don't use continuously colchicine. Your doctor will tell you, let's use it slowly by slowly. So if you have a problem with magnesium, which may bring this problem, you're correct, or calcium abnormalities. But if you have a problem by your parathyroid gland, visit your doctor. Let your doctor decide which type of drug you will use according to the levels of these electrolytes and hormones that are in your body, and cytokines that you have, you personally, at that time. So it's very important. You've seen it's very important, my people, to go to a doctor. There are some people in African societies, and some, not even other people in some places, a doctor may write a prescription and request some tests to be done. But some people don't want to do the test because financially maybe they are seeing this doctor is training them. The tests are very important because the doctor wants to get down to the cause so that he can treat without giving you painkillers or randomly assuming that this is gout. It may not be gout, it may be calcium phosphate deposit, psudogout. You see, And maybe you may be having no the pulmonary TB, but it's TB arthritis. And the doctor is asking to know what kind of TB you're having. So people, it's very important, as you have seen, to do tests. These tests help to narrow down to a specific thing that may be easy to, it guides us to treat you well. And as I finish, because the time is going out, it's already 6:30, my message again, the message of this video, please, 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 if you are a patient or diagnosed with TB, or you are around a person who is diagnosed by TB, release to the society, but this person does not take the medication as needed, guide that person. If that person is not listening, report that person to the nearest health facility. Why am I saying that? I'm saying that because of this. If you don't take these drugs as needed, what will happen? The TB that you're having will mutate and it will cause resistant TB. And you, because of your negligence, you will pass that resistant TB to someone else. And that person will have a problem of being treated because of the negligence of the person who did not take instructions well. So if this train goes around and around, what do you think is happening? We are killing the future generation. So let's listen to our doctors and let's advise other people well, and let's take steps as needed. Don't say that it's not my family that is included. Your family, your daughter, your son may be playing with the son of a person who is negligent, and it will bring to your house. So let's avoid TB resistance. Let's kick out TB by taking control measures. If there is anyone that has a question, please let me hear as I go out right now. Let's go out. Thank you, everyone, for listening and being on this platform. If you have not subscribed, please subscribe and tell a person as we grow together. I see no questions today. Have a lovely time wherever you are and everyone. Thank you.